Hello, everyone, and welcome. I'm James Milan, and I am. This is our weekly update around COVID-19 in Arlington. Usually, as you know, we talk to our town manager, Adam Chapdelaine, but every once in a while, we get to go right to the source, the person who's really kind of overseeing Arlington's response to COVID, and that is our Director of Health and Human Services, Christine Bongiorno, who joins me today. Thanks a lot, Christine, for taking the time. We always thank you, but we are particularly acutely aware that you've got perhaps the busiest job in town right now, so we will get right to it. I know that people are generally aware that vaccination started here in Arlington last week, and we'll certainly want to get to that. But before that, let's look at the latest numbers, please, together. And just have you, give us the current COVID-19 Arlington update, please.
Sure. So we're currently just under 1,300 cases since the beginning of March last year. We're seeing a slight uptick since the Thanksgiving holiday, through the December holidays into the new year. We've definitely seen a dramatic increase. December was a very busy month, and January is trending as well to be quite a busy month. We're at 71 deaths so far here in Arlington. We've definitely seen an increase in the number of deaths over the course of the past month as well. With the rollout of the vaccines, we had hoped that number would have stayed very low, but unfortunately, what we're seeing is that it's still unfortunately hitting the older population at a pretty significant rate, both here in Arlington and across the state and across the country as well. So those are our numbers, and we're hoping that we can continue to try to curb the spread, but the numbers they continue to come in, the cases continue to come in.
Yeah, a couple of things that I noticed in looking at the numbers before we started chatting. One is that the rise seems to be greater among the youngest population, 0 to 20, really. Folks, that rate has just been increasing at a higher pace than with any other of the other age groupings. And I'm wondering what your thoughts are on that, if that is indicative of anything specific or just, arbitrary or what?
So we do know that age group tends to do much better when it comes to COVID than perhaps the older groups. So there's definitely less fear among those ages. They're also gathering more frequently. So there are a lot of activities that are going on outside of school and outside of the family unit. And so we're seeing the spread in those areas. We're not seeing a lot of spread in schools. That's one thing I really want to make sure people are aware of. I think we've done a great job with the schools across the state as far as, the 6-foot distancing, the masking, and just the mask breaks outdoors. So the strategies that are being put in place in school may not be the same strategies that are put in place in the the outside school activities, and then the gatherings that are happening in the home after school and on weekends and whatnot. So we're definitely seeing that population gathering, sometimes not wearing masks, and so those are areas that we have seen an increase in cases. They're often asymptomatic carriers, so they're often tested when their families are traveling or they have a family member that's positive. So we're not always catching them as frequently as we would want to be. But, I think in Massachusetts, we've done a great job offering testing for the asymptomatic individuals. And so a lot of those people that may be under quarantine for other reasons are going to get tested, and then they're becoming, they're showing that they're positive as well. So yes, we've seen that increase. It is something that we continuously stay on top of. When we do our case contact tracing, we're interviewing the cases to determine where they've traveled throughout the course of the past week, right? To sort of figure out where they've been, where they could have picked it up. And then we use that information to drive our decisions, both at the town level and the state level, on closing different activities, limiting different pieces of activities in order to curb the spread. So, that's something we'll continue to monitor here locally as well as at the state level.
Okay, so my own conclusion would be it is not of tremendous or urgent concern to us if there is this kind of more rapid growth in that age group, because in general it does, they just can deal with it much better. And it also has to do with the kinds of gatherings that you as public officials can encourage folks not to do, but nonetheless, are kind of a natural tendency for younger people.
Yeah, I
Um,
mean, yeah, I mean, I would definitely say that the increase is of concern and urgency. It is an urgent need for that to stop, because anytime we have a virus or some sort of a disease within a community, we know that it's spread very rapidly through the youth, right? And then they bring it home to their parents, then their grandparents. That's sort of how we see the progression of disease in our communities, and that's exactly what we're seeing with COVID, and we've seen it, from March. So in the majority of the cases that we've seen, because we weren't in the early stages testing the younger people, we were seeing the middle-aged folks passing it on to the seniors, and that's where we were seeing the deaths. And so to lower the death rate, we're going to want to lower the incidence among the younger population. So a lot of the home health aides or nurses and physicians may have been positive at that early stage, and they were passing it on to the people they were working with, the seniors, and so they may have been getting it from their children and their grandchildren. So I think it's extremely important that the younger people understand that they may not exhibit symptoms, but their older family members, their older neighbors, their friends, older family members, so it's like this ripple effect, that it does at some point down the line impact our community. And so their trip to Florida and gathering with friends, and they come back positive, they will cause illness in an older person at some point down the line. And they may not directly see that, but it will happen. And it is something that we are most concerned with.
that is a great point. Just have one more question about the numbers here in Arlington, and that is, looking at the graph that accompanies the data, or in which the data is put on the town's website. It is pretty dramatic to see the growth represented that way, the growth over the last couple of months. And I just wanted to ask you to take a step back and give us answers, if there are, to such questions as, what is this surge really attributable to? Does it have to do mostly with moving inside as the weather has gotten colder? Is it the coincidence of the holidays as well, which you had mentioned when you were speaking earlier? What is driving this?
So we know that November and December were a lot of family gatherings, holidays, end of year celebrations. Most of those were indoors. As many times as we warned people not to gather, they gathered. And we're seeing that directly in our data. So every time we get a new case, our department is calling those individuals and doing contact tracing to determine where they would have gotten it and where they were in order to prevent the future spread. We learned that so many people gathered, and when you're gathering without masks in a large group indoors, you are essentially setting yourself up for failure if somebody in that group has COVID. So we're essentially assuming that everybody in that group will become positive at some point soon. So we saw a lot of that over the holiday season, and that slowly grows, right? So the numbers will slowly grow until the point where we're at now, and so it's the gathering indoors without masks. And oftentimes I hear from individuals that say, I trust these people, they're my bubble. Well, that's great. We all want to have our small our small bubble, but when those people go outside their bubble, that's when they're exposing your bubble. So it's this ripple effect in that regard as well. And so we see a lot of that, and people trust other people, and they could pick it up anywhere. And so it's just the smallest group that you can possibly have within your family unit, the better. We're seeing a lot of spread within the household as well. So if one family member is positive, the rest of them will become positive at some point, because it's just so contagious, and almost impossible within the family to control the spread. So we're seeing that impact right now. And so it's the numbers are reflective of the gatherings that we had seen over the end of year celebrations.
And certainly we are looking at, 2 to 3 more months of a lot of indoor time. And we need to be particularly mindful and careful as a result.
Exactly. And travel as well. Travel was a big driver as well. And I know that a lot of people are planning travel plans for February vacation, and it's important to think twice about that, because that is an opportunity for you to go to a destination, either bring COVID with you if you have it and you don't know, or you come back and you're bringing COVID back and into your family, into your home. And I think that's something that we are really urging people to consider holding off for now. And I know it's hard to say, we've been doing this for a year. We've been doing COVID, prevention for a year, and it's really hard, but we're almost there. We're almost at the end. And the more we can do to sort of prevent that spread, the better for everybody.
Yeah. Hope people hear those words, coming from your mouth, which, you are our local expert here. And I hear you saying we are almost there. We just need to hold on for a little while longer. So hopefully that will gird people
Yeah.
to be able to do so. All right. Thank you very much for that update. I want to just take the time that remains and talk about the town's vaccination plans. As I mentioned earlier, people, of course, are aware of the fact that the first round of vaccinations in town took place last week as part of a clinic for first responders for Arlington and a few of the surrounding communities. You and Arlington were in charge of that and the locus for it. First of all, how did it go from your perspective? And then beyond that, what is the future vaccination plans as we understand them
Sure.
for town?
Yes, so Arlington partnered with Lexington, Belmont, and Watertown to run a first responder series of clinics. We had 600 first responders. We also added in a few other categories, so school nurses in our communities that are doing testing or vaccinations with our group, and also congregate care sites. So persons that worked in shelters were also invited to participate. The clinics went very well. So we were given 600 doses by the state. And we were able to, I don't know if you've seen in the news, but some of the vials that come from Moderna have a few extra doses in them. So we were able to pull a few extra doses. And I can proudly say that we used every single dose. I think the total number that we had was a bit over 600. So it was about 652 doses that we were able
Great.
to tap into, and the additional 52 people that we hadn't anticipated vaccinating but were able to. We were very excited about that.
Yeah.
So we've been practicing. I think I mentioned this on our last call. We've been practicing these plans to dispense vaccinations to our community for about 20 years now. And so we use our flu clinics every year to practice those plans. And so we're I don't want to say we're experts, but we've got this down, and we are really we were able to use last week's clinics, which were very small. I mean, we had 150 per clinic. We were able to use those opportunities to really make sure we had it perfected for COVID vaccinations. And so, the vaccine's a little different than flu, and waiting after is a little different than flu. Like, different steps are a little different than flu. So we were able to make sure we had our systems and our process down for the big time. So we're anticipating rolling out vaccine, provided that we receive the vaccine from the state. Our goal is to start next week with the state is allowing us to vaccinate the remainder of the persons within phase 1, which includes all the home health aides, all the persons that are going into homes and doing medical visits, and anyone working in healthcare in the home, as well as anyone non-COVID facing healthcare. So that would include dentists, physical therapists that are working at a building, everyone else that's remaining in phase 1, which I think is really exciting, because if we can finish up phase 1, we can then jump to phase 2, which I think is really where the biggest impact will be. I think that I'm not saying that the phase 1 isn't big impact, but when I can start going into senior housing and start vaccinating people that I am seeing pop up as positive on our list, we will start making a bigger impact in saving lives. And I feel like that's really where I'm excited to go. After that, then we start rolling into the 75 plus age group with the comorbidities. Again, another population I'm just so excited to get to. And so our goal is to We have decided to move forward with a partnership with Lexington and Belmont. Watertown's going to move off on their own, so they're going to do their own thing down in Watertown. We are going to start with 1,000 people per week at the Arlington site, perfect that, and then replicate that in Belmont and Lexington. We've already chosen our sites in those two communities so that we can do 3,000 doses per week in our 3 communities. And just the more we can push through, the faster we are done, and the sooner we're going to be at the end. And as long as the vaccine keeps coming, we are just going to be vaccinating. We've got an amazing community of volunteers. We've got our school nurse team behind us. We've got paramedics. We've got our EMT, Armstrong ambulances on board. We've got an amazing medical reserve corps of volunteers, both medical volunteers as well as non-medical volunteers, because that's just as important to run a clinic. But we've got our teams in place to start, and so we're ready to go. We will be opening up once we get confirmation from the Department of Public Health as to what we're receiving for vaccine next week. We will open up our clinic to that next group of people. So there's a lot of anxiety in our community, a lot of anxiety in the world, I think, right now about vaccine. And so I think what we're trying to communicate to our population here is that we here in Arlington, Lexington, Belmont are doing what we have to do each week to comply with the state. So the state gives us vaccine, they tell us which category we can start vaccinating. We will reach out to those individuals within those categories, vaccinate, and then move on to the next and keep moving on till we are done. And so we have a lot of individuals calling our office, calling various departments, asking, when can I get my vaccine? When can I get my vaccine? And so I think the message we're trying to get out, and we've been getting out through our various channels, is that hold tight. We will be in touch with people when we're ready to start their category. And we created an online Google form for people to put their email on this list. It's not a list to guarantee a spot for a vaccine, but what it does is it gives us an opportunity to reach out to individuals when it's their turn. So on that Google form, they can disclose whether they're whichever category they fall in, so that when we're ready for that category, we'll reach out and say, here's the link to sign up for a vaccine. We will see you next week. So sort of just giving people that ability to understand that they're not, we're going to reach out to them, and we'll be getting to them at some point soon.
Right. So a step that people can take,
Yes.
as they await, basically the decisions made at other levels and that you will then put into practice.
Yes.
Couple of things on that. One is you mentioned reaching out to folks, and obviously people do have the opportunity to make themselves visible in this way in terms of the Google form. But you're I assume you guys are confident that in your ability to contact those in the populations who become eligible when they become eligible. You're confident about that.
We are. I think that in addition to our office, the state is opening up some regional sites. Their hospitals are opening up sites. So there will be plenty of opportunities for people to access the vaccine. I think we're looking at our site as a place where we can vaccinate a lot of people in a short amount of time quickly, and just to help add to the state's effort to vaccinate, to get the vaccine out. There will be so many opportunities for people down the line to get the vaccine. We'll reach out to the groups we know, like for example, senior housing buildings. We will be in touch with the housing authority. We've already got our plans in place with them. As soon as the vaccine arrives, we're going to set up these clinics. We're going to go in with this team and use this space, and this is how we're going to roll it out. So we sort of already have those populations addressed. The seniors, just the 75 plus. We've got the Council on Aging as part of our team, and ready to go and hit the ground running to get to those people that need it. So we will use our channels. We're in Arlington. It's really hard for people not to hear what we're doing. I think between social media, family networks, our other providers in the community, we're able to reach the people that will be eligible for the next phase. The news media is really good at educating people as well. That prompts a lot of calls. So the information will be available, and people need to just sort of hold tight for now, because the vaccine roll is a little slow, and it's coming, and it will be here, and it will be here all at once, unfortunately. And there'll be just a lot of scrambling. But I think here in Arlington we'll have a very solid plan for people to access it.
Great. One last question. I know that the site for last week's clinic was Arlington High School, and you've just mentioned that in this next phase, you're going to be able to vaccinate a lot of our older population. I assume that means you'll be going into the places that our older population live. Will Arlington High School also continue to be a site for people who are, easily ambulatory and can make it there?
Yes, absolutely. So the goal is to for the people living in senior housing, we're going into those facilities. So we've always done that for flu vaccinations. We'll continue doing that for these vaccinations, and those will be closed sites. So only the people that live in those buildings will be invited to those particular clinics. We'll have a team sort of rolling through and doing building by building. The high school site is the best site we have here in Arlington. The facilities department in the town worked tirelessly to make sure that HVAC system is one of the best in town. So we know that air in there is safe and perfect. Shouldn't say perfect, but it's safe. We know that the space is really accessible. So there are no steps up, there are no steps down. It is the best space for now. Our school department is fully on board, both our principal, our superintendent. They couldn't have been more supportive. I think they see that this is like going to get us back to normal and get us back into school. So they're really excited for us to utilize that space. It's not used on Wednesdays. Wednesdays will be our day to use that site. We've also thought about additional days for after school, but we're going to focus specifically on Wednesdays to start, and again, then replicate this in the other communities that we're partnering with. So then there are 3 options for people to access. We've used the high school space before for our H1N1 clinic. We were able to vaccinate 2,000 people in a day. So that is a good space. It's a good space to push people through quickly, without issues. So.
And the current rebuild is not causing any complications for
It is
access.
not. It is not. In fact, it actually, in some ways, Wednesdays there are no cars there, right? There are very few staff or students using the parking, and the construction site, their staff are using a sort of a space for parking a little further away. So by doing appointments, we know how many people to expect every hour. We've got enough parking, enough space within the facility to kind of push people through. So it really works to our advantage to use that space, both parking, traffic flow, and then just flow within the site and space. So it is sort of it's the best site we have in town, and a pretty good site, I would say, just in general.
Well, we always know when we get to talk to you that we are going to get a really comprehensive and thorough, both broad and deep perspective on what is happening. And that's what you've offered us again today. Thank you very much.
Yes, thank you.
We will let you get back to your work. I have been speaking with Christine Bongiorno, who is, of course, the director of our Health and Human Services here in town. My name is James Milan. Thank you so much for joining us, Christine, and thank you out there for listening in. We'll see you next time.